Hi guys, almost every one of us using pulse oximeter nowadays. In this video, we will discuss how to use it properly to get an accurate result. So in this video, we will learn about factors that might give you an inaccurate pulse oximeter reading. Now here, multiple factors that can affect the accuracy of pulse oximeter reading. And they are inaccurately positioning of the pulse oximeter, nail polish or pigment on fingers, bright light on the probe, movement of the patient, poor perfusion, carbon monoxide poisoning, skin pigmentation, skin thickness, and current tobacco use. So let us learn about each factor one by one. First and foremost important thing is to position your finger accurately. The finger should fit well and the probe should not be too tight because it can constrict the blood circulation. It should not be too loose as the pulse oximeter may fall off or let other light come in. This might affect your final reading on the pulse oximeter. Most commonly asked question is which finger is the best for pulse oximeter? We assume that right middle finger and right thumb have the most accurate value and reflects the arterial oxygen saturation. Index finger dominantly is fed from deep palmar arcus created from radial artery. But the middle finger receives both ulnar and radial arterial blood supply. So there is a higher perfusion in the middle finger. This seems reasonable to expect the highest and most accurate SpO2 value. However, this is insignificant. You can use any finger but make sure it fits properly. Now let's see how nail polish or pigment on fingers can affect the reading. The nail polish color can absorb light emitted by the oximeter and interfere with the detection of oxygenated hemoglobin. So it is always best to remove nail polish from one finger, but in case of an emergency, the probe may be turned sidewise. Here you can see in this demonstration, or use another side if possible. Now, in case of henna pigmentation on finger, what do you think will happen to the oximeter reading? The oximeter may detect a pulse but is unable to measure SpO2 due to the pigment blocking the signal. So you can select a toe or earlobe instead of finger. Now let's see what are the effects of bright light. Bright light such as sunlight or the operating light on the probe may interfere with the light detector and cause inaccuracy. But the probe has soft rubber to shield it from the light, so be careful with the positioning of the probe. It does not have to be covered, just avoid bright light. Otherwise you might get inaccurate results on your pulse oximeter. Movement of the patient can also affect the final reading. Here is an oximeter attached to the patient. The SpO2 is 98% and pulse is 72 bpm. The trace shows a waveform with a regular pulse. What is the difference with this trace and the next picture? Notice the pulse waveform is erratic and not being well detected. This is the same patient but has now started shivering, which can result in an abnormal reading and cause confusion. So hold the hand steady or wait until the patient has stopped shaking and then recheck. Now let's see what is perfusion index. Oximeters need a flow of blood through the finger to function. Some oximeters give an indication of the blood flow detected. In this oximeter, there is a scale which is an indication of the blood flow. Now let's see the effect of carbon monoxide poisoning. Patients involved in fires or who have inhaled smoke may have significant amount of hemoglobin combined with carbon monoxide. Most oximeters cannot detect this and tend to exaggerate the SpO2 value. There are other factors which can affect the pulse oximeter reading, and they are skin pigmentation, skin thickness, current tobacco use, and living in high altitude. So keep this in mind.